Good evening, Mr. Smith. How are you doing? You're doing well? Okay, my name is Deanna and I will be your student nurse today. Just gonna wash my hands before we get started. Can you tell me your first and last name and your date of birth? Okay, John Smith, 12/8/1988. Okay, I'm going to check your wristband to make sure everything matches. And okay, looks great. Mr. Smith, do you have any allergies? No allergies, nothing like latex, chlorhexidine, or tape? No? Okay, great. And I did want to ask if are you experiencing any pain right now? No? Okay, that sounds good. Okay, so I'm here because I'm going to change your central line dressing. What's a central line? That central line is that big IV your doctor placed in your chest with the tubing that goes to your heart. You have that clear bandage on the top of it. That's the dressing I'm going to be changing. It's our hospital policy that we change that dressing every 7 days to make sure everything is intact and clean. Does that sound good? Okay, so I need to wipe down my table and let it dry for 2 minutes. While it's drying, I can explain more about the procedure to you. Does that sound good? Okay, Mr. Smith, I'm just gonna wash my hands and grab some gloves. Okay, and I'll wipe down my table for 30 seconds. So the reason I wipe the table down is because we just want to make sure that the workspace we're using is as clean as possible. We need to do everything we can to prevent infection. The edges, make sure every part is saturated. I'm gonna go around the sides. Okay, so now it's been 30 seconds. I'm gonna let it dry for 2 minutes. Wash my hands. Okay, Mr. Smith, have you had this procedure done before? No? Okay, no problem. So I'm gonna start by removing that clear Band-Aid it's called Tegaderm. So I'm gonna remove that one first. And then I'll assess the site, make sure everything looks good. And then I'll replace that little blue circle. It's called a biopatch, another way to help prevent infection. And then I'll put a brand new Tegaderm on top of that. Does that sound good? Yeah? Okay. So this is a sterile procedure, so I'll be wearing sterile gloves and maintaining aseptic technique. So one of the ways we prevent contamination is by wearing masks. I see that you're wearing yours. I ask that you wear it through the whole procedure. I'm also going to have you turn your head to the left, and that just helps point your face away from the site when the dressing's not on there. And I'm also wearing a mask, just in case anyone coughs or sneezes by accident. We want to make sure the droplets don't land on that site when there's no bandage on there, okay? Do you have any concerns or questions? No? Okay, is it okay if I pull your gown down so I can take a look at your bandage? Okay. So I'm gonna do this. I'll keep you as covered as I can, okay? Okay, it looks good. I'm just gonna check at the tubing and make sure that the length is the same as it was last documented. Okay, everything looks good. Okay, Mr. Smith, I'm gonna have you turn your head to the left now. Do you need help doing it, or can you do it on your own? Need some help? Okay. Turn your head to the left. Okay. And I'm gonna wash my hands and gather my supplies. Wash my hands. Okay, so I'll need clean gloves, a pair of extra sterile gloves, and my biopatch, and then my sterile dressing change tray, and I'm going to just take a moment to set up my tray, and then I'll put my clean gloves on and remove that bandage, okay? Okay, so let me just wash my hands for 20 seconds. Okay, I'm gonna carefully peel the tray open. And then I'm gonna remove the items I don't need. So I won't need the gauze, the mask, and I won't need the alcohol swab or the barrier wipe. I'm gonna take my sterile gloves out. For when I need those, and then I'll take the tape out for a little bit later. The next thing I'm gonna do is drop in my bio patch. Okay. And then I'm gonna wash my hands and take that dressing off. Okay, Mr. Smith, are you ready to begin? Okay. So put my clean gloves on. Okay, I'm gonna start by touching the middle of this, and I'm gonna work around the edges, okay? Let me know if you have any discomfort or pain with this. It shouldn't hurt, you just might feel some tugging on your skin, okay? Pull around the edges. How are you doing, Mr. Smith? Okay. Okay. I'm gonna throw this dressing away, wash my hands, and I'm gonna assess the site, okay? It looks like there's no redness, no swelling, no signs of infection. There's no cracks, no leakage. I see that that clamp is secure, which it does prevent air embolism and also from blood coming out of the tube itself. And then I'm going to take one more look at that tubing, make sure the length is the same as the last documentation. And yep, everything looks good, Mr. Smith. Okay, I'm going to put on my sterile gloves and put a new dressing on. I'm going to open my sterile gloves. I'm going to be really careful to only touch that outer 1 inch. Okay. Okay, so I'll grab the first glove by the inner side, slide my hand in here. Okay. And then I'll grab the second glove by the inside of the cuff. Be careful not to touch anything, and then I can adjust my cuffs. Okay, I'm going to throw this paper away. And I can move my sterile tray closer to me. Okay, I am going to reach in and I'm going to flip that bio patch so I can grab it easier. Perfect, and then I'm going to prep that Tegaderm. Okay. So I have something to grab onto when I put it on. Okay. Okay, I'm going to grab your tubing with my left hand, which now is contaminated, and I'm going to clean in a 2-inch border around the tubing for 30 seconds. Okay, now that it's been 30 seconds, I'm gonna let it dry for 30 seconds. Okay, once it's dried for 30 seconds, I'm gonna clean up the tubing all the way to the top. Anywhere it's gonna be underneath that tegaderm, I want it to be nice and clean. Okay, I can throw my chlorhexidine away. And I'm gonna reach in and grab my bio patch, the taco method. Okay, being careful not to touch the bottom. And then I'm gonna grab my tegaderm. And with my dirty hand, I'm going to remove that packaging, and then we can place the tegaderm. Okay. All right, Mr. Smith. The new dressing is secured. I'm just gonna take the rest of the wrapper off, and then I'm going to label your new dressing. The reason we do this is we have another form of documentation of when the dressing was changed so that we know when to change it next. Okay, so I'm gonna grab my pen. I'm gonna write today's date, 3/2/24, and the time, 8 o'clock. So 20, and my initials. Okay, I'm also going to take a piece of tape and secure the tubing so that it's not bothering you and not moving around. I'm going to make a little butterfly so it's not actually touching your skin. Don't want an indent of that tube. Okay. And then I can have you move your head back to the front, okay, Mr. Smith? There we go. How are you doing? Really good? Okay, great. So I'm just going to throw away my supplies. We can reuse those. My pen, throw my gloves away. Okay, and I'm going to wash my hands. Let me just tuck you back in here. Mr. Smith, is there anything else I can get for you today? No? Okay, I'm going to go ahead and document this dressing change. Thank you, Mr. Smith. Okay, I'm going to document the time and date and my assessment of the site. I'm also going to document the length of the tubing, and I'm going to document that Mr. Smith tolerated the procedure very well.